hospital food is not that much good always.
Do you think our West Bengal doctor, I'm not talking about Indian doctor,
Okay.
West Bengal doctor, really they are educated or really they have degree?
Is it not possible to make private healthcare system a bit affordable for all?
It is why do the doctors charge that much of money? Because they have invested that much of money to be a doctor.
That's a very tricky question.
My first question is about like I mean that do you like Indian healthcare system?
There are a lot of things that I don't like about the Indian treatment system. Yeah.
I mean, what do you not like?
One thing that I particularly don't like is that in terms of like private like healthcare system, that the cost is so much high. Like for a simple thing, even if for a simple thing, they charge so much amount of money. That's one particular thing that I found very much disturbing.
Okay, but can we not change it? Is it not possible to make private healthcare system a bit affordable for all? Is it possible?
How can we make that? One way is that to enforce that they should not charge that much amount of money, but then they will kind of, I would say, they will find a loophole. Maybe they will purchase from a vendor who is already like selling them at a much higher cost, and the vendor will give some amount of the cut of the profit to those kind of medical systems. So I think right now, is there any other system? I think they will have to like kind of enforce that somehow. That for this particular item, you
Mhm.
shouldn't
Like there should
charge
be some
more than
rules,
that.
rules
Yeah,
and regulation regarding that.
yeah, yeah.
Okay,
And
okay,
how much the doctors are charging that
yeah,
part also.
okay, okay.
So my question is, what do you think about homeopathy and allopathy? And
Um,
why allopathy? We all know that it is the main like medical system in our whole India.
yeah.
So what is your opinion about homeopathy to have a new start and like as a sector or as an
Okay,
industry?
what I feel is that like allopathy is good for severe treatments. So for severe treatments, I would never suggest homeopathy treatment. But for small illnesses that we regularly get, say fever, cold, cough, for that kind, those kind of things, I think we should all like everyone should try homeopathic treatment as well, since it's quite they don't have that much like what do you say side effects. Cough syrup, lot of the cough syrup they have much side effects, and they go a lot of the time your like throat gets irritated after using that. So I would say they can promote that for less severe illnesses, and I think they should. And I know like many people also try. I was surprised that Rudran also takes homeopathic medicine. That was also a surprise for me.
So, what do you prefer?
I prefer for small illnesses. I prefer homeopathic medicine, but mild, yeah. But many people, for many people, when they have tried homeopathic medicine, they see that those are not that much effective for them. So for those kind of people, it's better to switch to allopathy.
Hmm.
Since if it doesn't get resolved quickly, then
And
it's
as a sector, as a whole, is it like
I don't think
does
they
it
that
have
much
a
promote that much, but I think people buy homeopathic medicine. A lot of them buy, and I have talked to many people. A lot of them for common cold or those kind of thing, coughs. Many people prefer homeopathic treatment.
no? Thank you.
So, good evening.
Yeah, good evening.
Okay, so my question is, what are the main problems in Indian medical system?
No, I have to discuss a lot of them. Okay, another thing that I feel is that like the hospital food is not that much good always. I witnessed that once in Durgapur. So I think hospital food should be better. Like there should be more items. It should be like a proper diet. A lot of the time they don't have that much like the finesse of the food. And apart from that, yeah, the cost of the private healthcare system that I just told you. And another thing I feel is that like in terms of like what do you say, like in when you go to any hospital, the caretakers, yeah, the caretakers, I think that for government hospital they should hire their own caretakers, instead of like when the family gets there, someone gets ill, you have to pay the caretaker to take care of your family member. That's what I feel, is that government should arrange caretakers. That's one point that I feel a bit bad about. Yeah,
Yeah.
because they have to live whole night. Yeah, like they should be like, government should like have opening roles for caretakers who will take care of them in different shifts.
I want to ask that, like, have you heard about Shastri Sati card?
Yeah, I have heard about Shastradhika.
So the thing is, why don't like all the hospitals accept Shastri Sati card? Like government produced it. So for
Okay,
the
like many government hospitals take, some hospitals take, and some hospitals don't take
hmm.
Shaswati card. I don't know the exact reason. I can like assume, what I presume is that like maybe they have made the system of Shaswati card not that much transparent, not that much accessible, so that not all hospitals they take that. Maybe they have, for when the hospital, say you are going to a private hospital, when they try to claim the the bill using their Shastra
Hmm.
Sati card, maybe there are too many steps, maybe the hassle is very long, maybe they take too much time to pay the amount of money. I think those are maybe the probable reason, that's why a lot of hospitals are refusing to accept Shastra Sati card. Yeah.
So suppose someone is very poor and he is a daily earner.
Yeah.
So if he don't go, say, sorry, doesn't go to work, he will not get money and he will not feed himself or his family. So he
Hmm.
will not be able to
Yeah.
do. So sometimes, like in government hospitals. So for them, like for that type of persons, government hospital is the only choice.
Yeah.
They
Yeah.
cannot afford the any type of doctor or any type of like private sectors,
Hmm.
so they will prefer government hospital.
Yeah.
And in government hospital, like after like 7:30 or after that, like they don't give outdoors, they only give emergencies, emergency
Hmm.
services.
Yeah.
So my question is that, suppose someone is suffering from fever, maybe it is not that much serious, but it is quite serious.
So from fever, that's not that much serious to go into emergency, but
Hmm.
quite severe.
But it should be like checked by a doctor.
Okay.
Okay, but somehow whenever that person is going to in government hospital, that
Hmm.
I have this type of problems, but they are refusing to listen and they are just giving some common medicines as it is an emergency service. If it is not serious, they will not check it out.
Hmm.
Yeah, that is the thing, that is my point. So do you really think it is fair, like it is not possible for
Okay.
him to
Okay.
go in the morning?
Hmm. So one solution is that they should keep a night doctor, some night doctor for who will give the checkups. But for that, I feel your point, that for every specialization kind of treatment, they will have to keep one doctor for whole night period. Okay. So will they keep one for the for outdoors? I think the situation is that maybe not that many people visit at night for
Hmm.
regular treatment. So if they keep a doctor, most of the time he will be just sitting there like without
Yeah,
any work.
actually, what happens in the emergency situations, they just kept like keep one doctor
Yeah.
who has general physician degree,
Hmm.
and or that type of
Yeah, that
MD.
kind of one doctor,
Yeah.
I think they should keep as a outdoor doctor for
No, no.
whenever needed.
In emergency systems, they keep this type of doctors,
Yeah.
and if there is anything emergency, then they call another doctors. And if
Yeah. Yeah.
anything serious like injuries for surgery, like
Hmm.
if he needs to be any
Hmm.
surgeon, then he calls. But the thing is, like I am telling about that poor man who is not able to go in the time period of outdoor.
Hmm.
How will he manage to um, get his medicines, proper medicines? Like in emergency, he will not get his medicine.
Like
They will give some common medicines.
yeah, the get like situation you gave, I think his situation is not that much severe, right? But I think
But
like
it
I'm
is
talking
not
about the
that much
solutions.
serious, but in long term, it may affect. So
Yeah, like if, for then the solution is that in hospital they should have a indoor doctor available 24 hours, so that they can give some like basic treatments and those kind of stuff to outdoor patients. So is that
no, no,
feasible? I think.
actually, in outdoor they give.
Yeah.
I am not like saying about this. Like
Okay,
I am
okay.
not complaining about outdoor.
Okay.
In outdoor system, like in outdoor, whenever anyone goes to like 10:30
You're
to
talking about
9,
like some
7:30.
specific
Yeah,
diseases
I
someone
am.
has.
No, I am saying it again. Okay.
Yeah, I'm
Suppose
not.
someone is too much poor.
Yeah, yeah,
He
yeah.
is a daily worker,
Yeah.
so he cannot manage his time to go to outdoor in hospital.
Okay, so every day he doesn't have that much time. Okay,
Yeah.
okay, okay. Yeah, yeah, like on Sundays or something. Since you told that it's not
He
that
is
much
a daily
available.
worker.
How will he go to work?
But you see, what's the solution?
That
Some
is a
doctor.
severe problem. That is
No,
so he
no,
can go.
but see, what's the solution? They would have to keep one outdoor doctor throughout the whole night. Okay,
Yeah, that is not possible also.
but that doctor won't be able to work during the day,
Hmm.
and at night he's not checking that many patients, so his pay will be lower. So
Yeah.
so why would any doctor be willing to do that? That's my
Yeah,
question.
that is your question. So where is the solution? So what will that man do?
I would say this get a break for some day. That like that happens for my dad also. He works all the day. Like sometimes he takes a break, but apart from that, yeah, I don't
That
think
is really a problem.
no, I don't think they should have a like doctor all throughout the night.
Yeah.
Like that's too much bad for the doctor as well. But yeah, they can like increase the time to say 10:30
Actually,
or something.
don't you think like if the emergency doctors pay attention to those type of things, it will also help. But they don't pay
I would say
attention.
not. You know why? Like for most of the emergency doctor throughout the day, they are handling so much patient in such a rough condition that at the end hours, there most of the doctors get so much tired also. They don't get have that much like of energy also. So I
Yeah.
think they also need some rest. So I don't think it's good to have emergency doctors to attend to general patients. I personally
Okay.
feel that.
Okay.
Okay. Tell me, do you think our West Bengal doctor, I'm not talking about Indian doctor,
Okay.
West Bengal doctor, really they are educated or really they have degree, and how to choose they are really get degree by what I say. From a medical college. From a medical college means how to choose they are fake or they are, because many people suffer visit doctor but
Hmm.
still suffer injury or health problem, and
Okay,
how to
so
choose and what do you think about
yeah,
it?
I personally think is that if you are having some problem, like what I personally do is that ask my neighbors and people around that which doctor they prefer. If I have some preference of some doctor, then I usually go to that. And I know from the fact that you said like one of my like close relatives, they also visited Kunal Sarkar. I think he's a very renowned doctor. He also just looked at the patient, didn't give that much time, said you should have this much medicine. He didn't even recommend any test or anything. Like he didn't even like properly did the treatment. So that point is like he's a well-educated doctor. Even well-educated doctors, they also sometimes don't give that much time to patients. So I feel like while choosing any doctor, you should have kind of like reviews or something. You should look to them.
But all the people also sometimes they are fake. Sometimes, if you want to be a doctor through the study or through the YouTube, you can be.
Yeah, but yeah, or they mention that what degrees do you have, but yeah, you
Means
should
what do you think means
you think that you should
how
have
to
a way
how
to
to
verify that.
forget about people review, okay,
Yeah.
because review nowadays reviews we buy, we can buy, okay.
Yeah.
So how to means what can will do or government can do for reality to check, how to check reality means how what type of thing can do that we
Hmm.
know the actual they are
Actually, I want to say one thing.
certified.
Yeah, actually, I want to say one thing that is. Yeah, it's okay. I want to say one thing like that is you can see about the MD tag. It cannot be buy bought like easily. So if
But I think
any
she is
doctor has,
asking like if somewhere the
yeah,
doctor is using a fake MD tag.
yeah, no, like
Oh.
no doctor can use MD tag like fake MD.
Her question maybe they have the degree but not experience. That is her question. Experience
Hmm.
and for example, all doctors are not good, but the problem many patients are facing, they have been
Yes.
visiting the doctor for a long time, but they are not getting the cure. That is the problem.
poor people suffer a lot rather than
Since
us.
they need to change the
Yeah,
doctors
because
so many
they
times.
believe in a lot. Means if you do some puria or something, they believe. Poor people believe most. Okay, and they think they are God for them. So how to avoid them? That they are not God. You go
That's
means.
a very tricky question. Yeah, like I have this solution, like
I saw
having
that's why.
personal recommendations from someone who has visited the doctor, or yeah, reviews. You said yeah, reviews can be bought. That's one thing I totally agree with you. What another thing that we can have, like to verify whether a doctor is a good doctor or not? Reviews, like for that you would have to talk to someone who has visited the doctor, unless there is no other way. Yeah, yeah.
Maybe government should very strict about their education, means they will never pass or any by any cheated.
But you know our country, like they can just bribe their way out of that. Then we have to change the whole system of our country.
Topic is stop if you
Yeah.
talk about government.
Yeah.
All the topic is stop. Which earphone?
Just silent that. Yeah.
No, no. I will be silent.
Yeah, that's the thing. Like, are there any other solutions? No, that solution is
Okay.
the best solution, but I don't think it can be implemented.
Okay, another question is how to stop doctors' greedy behavior. Means
Doctors greedy.
greedy behavior. How to stop? Means what I will do that.
I think at this moment it's like manifested in the society. Everyone knows that when they become doctor, they will have too much amount of visit. One thing that can
Many
ensure.
other people or other profession do the thing. It's okay because sometimes for doctor we call doctor as a, for our opinion, doctor is a god. Okay,
Yeah.
we think like this,
Yeah.
but actually they are. And if they and I think that if we stop their greediness, okay, maximum greediness, you earn, but
Like one thing I can think, like if you try to enforce that they may not charge a visit more than this much amount, they will always find a loophole in that. Say maybe they are opening like a doctor's chamber, they will charge something that amount of money for something else, favor reception, they will charge
yes.
that kind of thing. So is there any way to kind of enforce that? I would say you would have to change the mindset of the doctors. Otherwise, there is no proper way to rule that you can enforce. Since there are many like private, yeah, yeah, like think about the private healthcare systems. They are the doctors. They can charge any amount of money. You cannot enforce that properly.
But I think that if they not stop their that type of behavior, medical will be not change in future.
Yeah, like one thing is that to change the mindset of people.
How
Like,
to change?
I would say like it will take some time, but kind of like to promote that, yeah, that doctors should not charge that much amount of money or dollar. Like that's my one solution.
Okay,
Like
okay.
apart from that, I don't think there are much of any. Can you think of any solutions?
Yeah, yeah, yeah. Tell me.
Like it is why do like doctors charge that much of money? Because they have invested that much of money to be a doctor. So they have that mentality that if they have any like ward, like daughter or son, if he wants to be a doctor, then I have to invest that too for
But
yeah.
right now, if you lower the charge, like for government medical colleges, they don't have that much amount of cost, but still they charge so much from the patient. How can you?
No, no, no. In government hospitals,
As like every doctors have to go through a period like when they will start the government hospital. They are doing that.
No, no, I'm saying like someone is passing from government medical colleges and they are opening their own chambers. They are still charging a huge amount of money.
the person who wanted to go there, he can give the money, right?
What?
There can be two reasons, two major reasons. For example, when someone can charge most because maybe there is no competition.
Yes, 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 yes. That I also
Competition is there.
I
That
thought
means they are only communicating, no other specialist is
there is the monopoly kind of thing
So
in
somehow
one
the
area.
number of doctors are less in our country. The number of doctors should be increased. I think this can be one. Just
Yeah.
see in Khorda, how
Then
many
this can
doctors
be.
can you find? Very less. countable. So if the number of doctors increases, then it can be possible, like they will go with that service, like they will think we should also have some
We need to increase the number of good doctors. It's
Definitely,
like there are
definitely,
only a few
exactly.
good doctors that like all of us just huddle there to do the checkup.
Just see, many professions are there. They are having some, that like type of competition. Will charge less, will charge less. But here, the competition of charging most.
No, they charge for visit, it's okay. But they charge another way. You know very well. This we know very
Yeah,
well.
yeah, like many of chambers,
Testing.
yeah, they
Testing
have
is
their
not
testing in
necessary.
their
Okay,
own.
CBC
Yeah.
testing. I already tested. No, I told you test from this laboratory.
Yeah, since they
Then
have
I will
some
take it,
affiliation with
no, I
that
will not take.
laboratory. Yeah.
So I think it's not justify or it's not okay. Okay, maybe not need this medicine. Okay, you maybe take other medicine in very less amount, but they prefer that type of medicines. Those
Those are the more costly
more
ones.
costly or
Yeah, I
expensive.
have seen that specifically for skincare. I have seen that.
Yeah, 100%. I use. That's why I'm
I also use, that's
telling.
what I
That
know.
same composition you have option,
Yeah,
but they
yeah.
prefer what from they got the money or percentage.
Like
So
the dermatologist, she prefer like recommended all of the medicine from the same pharma company. So
okay,
yeah,
if
they
the
have some
medicine is
bias.
120, okay,
Yeah.
and 11,000 maybe, so you can prescribe 120, but they never prescribe you.
Yeah, yeah.
So that's why I'm
But I
telling.
don't think there like are there any way to change that? I can't think of any
I
way
think
where.
government. I think government can change.
Actually, there are like medical representative profession who like give the doctors suggestions to like promote their
Yeah.
medicine. So
Yeah.
there is the whole profession around that. So we cannot like take that.
But that profession is also necessary to like recommend new medicines.
Yeah,
Yeah.
that's true. But they use like if they give
Like I think they
sponsor
promote.
the
Yeah, yeah. They obviously
more.
they misuse that, but
Yes, yes.
they surely misuse that.
I have a question. That actually in India, like especially, that like in rural areas, many people die due to lack of treatment.
Yeah, since like there are too much many less hospitals and their
Like
hospitals
even
are
like
also
being
far away.
hospitals, there are hospitals, but still many people die due to lack of treatment. Even many cases, their main like maybe that like main disease was not found properly or tested previously. They found at the final age or last stage. So many problems are there. They died due to different type of reasons, but number of death
Okay.
in whole world due to lack of education, I think India is
Yeah,
in a
I think
number.
what happens is that for people in the villages, like for people in the cities, even if you have a small thing, very small thing, we often go to check up. But in rural areas, they don't. They are maybe having some problem. They say, "Oh, it's fine. I will check that
So
later."
you want to
Until this.
blame people for this?
No, no. I would say that they should be more aware. Like village people, we can try to make them more aware that they should, even they have a small problem, they should go to any medical hospital for
No,
checkup,
no,
any
but
government
like
hospital or anything.
that is mean not like I'm not talking that like due to no treatment, they are dying due to lack of treatment.
Okay, so they are going to the hospital and there is not
Definitely,
proper
definitely,
treatment.
definitely. That is the thing.
Okay, yeah, that's what I mentioned. Like there are many government hospitals, but not all of the government hospitals have that kind of specialized doctors. Most of the village areas, there are many government hospitals where they don't even have like a treatment for all of the kind of diseases, all the domains of diseases. So I think they should do one thing is that properly have that many doctors so that each hospital is capable of sustaining for all the dimensions of diseases. That's I think one thing that
Yeah,
can.
it can be. Okay.
Actually, I want to say like it may happen. Maybe the
Yeah. Yeah, the person works throughout the day and he doesn't take care of it.
no, actually, in village areas or in rural areas, the
Yeah.
doctors are not that much active, you can say. And the thing is like maybe there was one politics like in city in you can see if any patient dies, the doctors have to like answer the reason. Yeah, what is the reason they have to maybe there is the victim can what can the victim's family can report against the doctor.
Yes,
It can
since
happen that type of things. But in village areas, if they even don't know about that type of rules.
yeah, that's the thing. Like village people, they are not that much educated that they think that they should maybe complain against the treatment
Yeah.
system or those kind of
And
things.
I think
They don't
the
take that much
doctors
necessary
that take
steps.
like
Yeah, and another thing is like regarding like doctors. I think like if you feel from the point of view of a doctor also, like say there's a good doctor, he won't even prefer to go in a village hospital. He will prefer to go in a hospital in SSK or Sarodat. Like I personally can't blame that the doctors for them unless they provide good accommodation. The hospital they say provide good accommodation to the doctors as well nearby the hospitals.
We can't change our medical.
But for yeah, for that will be very much costly also. I don't think government is capable of giving that much amount of budget to healthcare system instead of
if
promoting
Nirmala
politics.
if Madam Nirmala is our
Yeah.
then it's possible.
Okay.
That should not be recorded. Any question?
No. Okay then.